Let's get right into it. Have you ever walked into a hospital room and just felt your chest instantly tighten? You know the feeling. You're suddenly surrounded by this absolute maze of blinking screens, humming boxes, and tangled wires. Well, welcome to This Explainer. Today, we're unpacking Zahid Chaudhry's fantastic guide, Medical Equipment for Everyone. And our mission here is pretty simple, honestly. We want to decode the hospital room and help take you from a place of fear to a place of pure empowerment.
It is so true that hospitals can feel incredibly confusing and honestly frightening simply because we don't understand what we're looking at. Imagine a loved one lying in a hospital bed. The sensory overload is absolutely intense, right? You've got relentless beeps, oxygen masks covering faces, infusion pumps slowly dripping medications, alarms going off seemingly for no reason at all. When you don't know what these things actually do, your mind naturally races straight to the worst case scenario. So if you feel that fear and anxiety, it's completely natural. After all, that environment was built for medical professionals, not for us ordinary folks. Okay, let's dive into this. What if those terrifying beeps and alarms aren't actually sounding a death knell? What if they're simply the machines doing their job, monitoring, supporting, and guiding the care team? The whole foundational solution presented in Zahid Chaudhry's book is just that. Basic awareness strips away fear. You don't need a medical degree to feel comfortable in a hospital room. You literally just need to know the basic purpose of what you're looking at. By understanding why a machine is sitting there, you instantly reframe the whole situation from a terrifying mystery into a managed, controlled environment. But before we go any further, we really need to set some ground rules on what this guide actually is. This material is built for practical awareness. It's meant to help ordinary people, patients, families, students, caregivers, make sense of their surroundings. What it is absolutely not is a clinical manual. It's not a diagnostic guide, and it for sure does not replace professional medical advice. You should never ever use this information to self-diagnose or alter a treatment plan. Think of it simply as a tool to help you grasp the purpose of common medical equipment. Now, to make this massive topic actually approachable, the book uses this brilliant, highly visual, simple icon format. Whether you're looking at a super complex ventilator or just everyday medical disposables covered in Chapter 1, things like syringes and IV tubing, every single item is broken down into easily digestible chunks. You get a quick overview where it's commonly used, its main purpose, some practical points for families, and most importantly, crucial safety cautions. It's a real game changer because it lets you quickly find exactly what you need to know without getting bogged down in all the heavy biomedical engineering jargon. I really love this concept, seeing the unseen. A person could be sitting right in front of you looking completely fine on the outside, but their body could be hiding high blood pressure, low oxygen, or even a dangerous heart rhythm. Lots of critical health conditions just can't be diagnosed by looking at a patient's exterior, and that is exactly where medical devices come in. They aren't just big, scary machines. They're translators. They gather up all that hidden information from inside the body and translate it into a language that doctors and nurses can actually read and use. And this brilliantly illustrates how that translation happens in very specific ways. For example, if the hidden condition is a spike or drop in blood sugar, the translating equipment is the glucometer. If it's a lack of oxygen in the blood, well, the pulse oximeter acts as the doctor's eyes. An ECG machine records the unseen electrical activity of the heart, while a CT scan reveals the intricate, hidden details of internal organs. These devices give healthcare professionals the exact, vital data they need, which they then combine with the patient's history to make life-saving decisions. Now, when we talk about emergencies, the role of these machines becomes, quite literally, a matter of life and death. In a crisis, every single minute matters. Specialized equipment helps healthcare teams act incredibly fast. An ECG can quickly pinpoint possible heart problems the second a patient complains of chest pain. A defibrillator can immediately shock and treat certain dangerous heart rhythms. An ambu bag steps right in to manually support breathing during resuscitation. These aren't just tools, they are massive emergency time savers that bridge the critical gap between a crisis and stabilization. But hey, we have to pause here for a really major safety caution. The book makes this crystal clear. In an emergency, do not delay hospital care while trying to understand every device. Yes, this explainer is all about empowering you with knowledge. But when things hit a critical point, your job isn't to stand there analyzing the machines. Your job is to step back, clear the way, and let the highly trained medical team do what they do best as fast as they can. Always ask your questions when things are calm and stable, never in the middle of a life or death crisis. All right, let's shift gears a bit and look at how this impacts our everyday lives. Because, it used to be that you only saw medical equipment inside the sterile, bright walls of a hospital or a clinic, but that has completely changed. Medical equipment is now sitting in our living rooms, our bedrooms, and tucked into our travel bags. It's migrated into daily home care, especially for elderly patients and those managing chronic illnesses. We're taking on way more responsibility for our own day-to-day health monitoring now, which is amazing, but it also means we absolutely have to understand the tools we're bringing into our homes.
I mean, you probably have at least one or two of these items in your house right now. Thermometers and blood pressure monitors are incredibly common, but so many families are now also managing pulse oximeters to check oxygen levels, glucometers for diabetes, nebulizers for asthma, and even larger setups like oxygen concentrators or CPAP machines. And it's not just the big machines. Families are handling everyday medical disposables too. Single-use test strips, sterile nebulizer masks, disposable tubing. These devices and supplies are fantastic resources, and they help families monitor health safely, but, and this is a huge but, they are only helpful when they are used properly.
What's fascinating, and honestly potentially dangerous, is just how easy it is to get things wrong at home. Using these devices incorrectly can create a dangerous false confidence, or, on the flip side, cause massive unnecessary panic. Take blood pressure, for instance. It must be measured while the person is sitting calmly, not right after they've jogged up a flight of stairs. Or a glucometer. It absolutely requires the correct, unexpired test strips and a strictly clean technique. Otherwise, you're going to get a totally bad reading. Using home equipment safely requires strict adherence to proper techniques. Having the device isn't enough. You really have to know how to use it. And this brings us right to a major issue highlighted in Chapter 1, the rapid, wild spread of misinformation, especially on social media. For example, the myth that ventilators actually kill patients. It's terrifying and it's completely false. The reality is that ventilators support breathing when the lungs are failing and simply cannot do the work on their own. Another common myth? That oxygen is some magical cure for any kind of weakness. The reality there is that oxygen is a specific medical treatment that should only be used when there's a documented medical need. Basic awareness is absolutely your best defense against making unsafe, internet-driven decisions. Throughout all of this, though, we cannot forget the most crucial element in the room. A machine is, at the end of the day, just a machine. It provides raw data and physical support. But a glucometer reading doesn't prescribe insulin, and a CT scan doesn't perform surgery. It requires human expertise, the doctors, the nurses, the technicians, and the therapists, to interpret that raw information and turn it into safe, effective patient care. Equipment never, ever replaces the clinical judgment of a healthcare professional. Human expertise is always the irreplaceable final piece of the puzzle. So what actually happens when we combine the expertise of the medical staff with an informed, aware family? Absolute magic happens. When families understand the basic equipment around them, they transform from anxious, terrified bystanders into active, communicative participants in the care process. You stop feeling like you're completely at the mercy of the machines, and you start feeling like you're a real part of the patient's support team. It's incredible how this basic understanding changes the entire dynamic and energy of the hospital room. Just notice how the whole conversation shifts when you have this knowledge. Instead of just standing back in the corner and asking, "Doctor, is it serious?" you can start asking highly targeted questions. Things like, what is that specific monitor showing? Or why exactly is the oxygen being given right now? What does the ECG help you check? Is this device connected for diagnosis, or is it providing life support? What warning signs should we as the family be watching out for? Asking these kinds of specific, respectful questions dramatically improves communication between you and the medical team. It ensures everyone is perfectly on the same page. So, the crucial point here is captured perfectly in this powerful reminder from the book, A Machine Reading is Important, but the Patient is More Important. Always look at the person, not only the number. It is so incredibly easy to get hypnotized by those glowing screens and the digital numbers fluctuating up and down. But you have to remember to look at the actual human being in the bed. How are they feeling? What are their actual symptoms? The machines are there to support the patient, not the other way around. I want to leave you with this final provocative thought as we wrap up this explainer. The next time you find yourself walking into a hospital room, a clinic, or even setting up care in your very own home, you have a choice. Will you let the unfamiliar machines and those beeping monitors build a wall of fear and anxiety around you? Or will you use the basic knowledge we've discussed today to empower yourself, to really understand your environment, and to ask better questions? The machines are just tools. It's completely up to you to decode them. Thanks so much for joining me on this explainer, and I will see you next time.